All right, guys, welcome back. Today is our first interview for our Provider Initiative series. One of my goals is to highlight some of the top providers around, whether they be doctors, coaches, anything kind of related to the medical field that relates to your health and wellness. Today with me here is Dr. Eric Fate. He's someone that I have been working with now for a little bit, and I've had great results with. I'm very happy with the service he's provided, and he has a bit of a unique practice that's different from what I've experienced in the medical field. Um, Dr. Eric, you are a mixed bag of functional medicine, sports optimization, health optimization, hormone regulation. So I'll let you talk a little bit about, what different things you do and why someone should come see you.
Yeah, hey Brett, thanks for having me on, my man. I appreciate it. Appreciate the kind intro. So I do have a broad array, and that's kind of what I'm working on now is trying to narrow it down a little bit and niching it down a little bit to my target because I do a lot of different things. So the super short summary is like health and performance optimization is what I do. So I've been involved with health and fitness for a very long time, and of course I'm a board certified physician, and so most of my clientele I'm working with, are looking to me for various things. So I started out getting into hormone optimization and really finding a way to kind of turn back the clock, right? To kind of keep my clients and myself younger and vital as we age. We tend to lose our hormones and our metabolism tends to get out of whack, and we start slowing down. Things start to hurt. The weight's coming on. Things are not functioning the way they're supposed to in various areas of our lives, right? So it's like, how do we fix this? How do we turn back the clock? I mean, we can't stop it, of course, but we can slow things down, right? We can improve our quality of life. So that's why it got me into the world of hormone optimization, metabolism, endocrinology, really getting to the hormonal pathways of youth, right? How we turn on our youth clock, right? That fountain of youth we're all looking for. And then, of course, I expand into more like peptide therapies, medical peptides, which have been around for a very long time and been really diving deep into that for the last number of years. It's a whole other layer, I think, will be the future of medicine if we can navigate the medical legal complexities. Started to, of course, I kind of did a lot of into the world of functional medicine, the gut, the microbiome, of course, which has been great, or picking up in the last number of years, learning more about genetic evaluation, genetic testing, really doing more deep dive into like nutrient status and just really finding all different ways to optimize my patients. And what I really try to do is two things. One is simplicity and personalization. So, and we can talk about this more later, but I really try to distill it all into make things as simple as possible because, as we all know, there's a way too much information out there. Too many people are, reading everything on Instagram and Dr. Google, and it can be very complex. And there's a lot of misinformation and myths out there. So I really try to cut to the chase of this is what works, this is what doesn't. Here's the truth. And not that I have all the answers, but I can tell you what's not true, and what really is working. Because there's still so much misinformation out there between social media and traditional medicine, and so on and so forth. And then the other thing I really try to hone in on is the personalization approach. Again, there's a lot of people out there and a lot of mills and big clinics that are just treating everybody the same way. It's this big cookbook kind of approach, and it just doesn't work. I really, you get just me and clients. They work with me. It's not this huge team of people and a cookbook approach. I really try to make everything as personalized as possible for each client, and I have an array of tools to use for that. So I can make even whether it's something as simple as hormone therapy. It's not simple; it's very complex. But hormone therapy, peptides, nutrition, diet, exercise, lifestyle, supplementation, gut health, all these different things. I try to narrow it down and make it as personalized for each patient as possible. So yeah, we'll talk more about later. Who I treat or what people are coming to me for. But in a nutshell, that's kind of what I do.
Yeah, and so I think one of the biggest things, in my experience working with you on the functional health status and working with my own autoimmune disorder and everything, is definitely the personalized kind of white glove experience I've had, versus I know for people out there looking for hormone therapy, there are a lot of these mills out there that people are going to and just like, oh, you want testosterone? Here it is. And we're going to put you on this. Everyone seems to get the same protocol and some things that are out of date or cheaper for that clinic to provide than what might be necessarily the best for you. Can
Right.
you highlight on that a little bit of like what people are getting from you versus, they go online, find a telehealth clinic and do that?
Yeah, definitely. And I see that a ton, right? And there's more and more of these big box clinics, these multi, with 50 staffers and all these different people, and people even just getting weight loss peptides and testosterone. They don't even see a doctor. They see like salespeople or diet, or like spa salons or somehow finding ways to get it kind of thing. It's just like, oh my gosh, they only if they have a provider, I'm sure they're just getting him to sign on the dotted line. They're not even talking to him or very briefly, and it's kind of scary. So, and I say that from the perspective of, again, not that it's my way, that everybody's got their own approach, but I see a lot of these people. They come to me because they've been to these mills. A lot of my colleagues that network with a lot of other top level physicians that are top in their field. That I network with, and we all talk. We communicate. We hear these stories, and we see these patients that go to these mills and these places with not even going to the Instagram guru who's a hormone expert, even though they're a personal trainer. They have no medical training. They've read some books or they've interviewed people like me, and now all of a sudden they're an expert, right? So, and they're practicing medicine without a license. It's mind boggling, but and they go to these patients, go to these people, and and sometimes they do okay. It's kind of like, look, can I take X supplement forever and be fine? Sure, but sometimes there may be a problem, right? So a lot of these patients go to these places and they get kind of messed up, and I just say that because I see them, and my colleagues see them by the hundreds or more, and it's like, and they're having problems because they're not put on the right protocols or the wrong dosages, or they're not getting personalized care, and they're having side effects, they're having complications, they're having bad things happen to them. That's not what I want. In medicine, the rule number one is do no harm, right? So I see these, and it's not just me getting on a bandwagon like, oh, you guys don't know what you're doing. There's a lot of great people out there who are helping, and they're trying, and they're doing a great job. But unfortunately, it's like anything. You gotta, something like this, you really gotta know, and it's not that simple. It's made out to be this simple approach, like, oh, just give them testosterone. It's not that. It's not always that easy. It's kind of like a workout plan, right? Can you go wrong with giving somebody just hit the weights, 3 days a week, do a 5x5, and you'll get strong? Will that work? Sure, but if they're not getting approached on how to recover, how to rotate your strategies, how to stretch, how to take days off, how to deload, what else to do, what not to do, how not to expand, and how fast to go up on your weights, all these different things. Obviously they could get hurt, right? So it's the same thing with medicine, and times 10. You got to have a very personalized, very detailed approach. Otherwise, something's going to happen. These hormones, these peptides. We're playing with very important things in your body, right? These have massively important and powerful effects. So you really have to be careful on what you're doing, just like anything. So yeah, so for me, again, it's making that personalized approach. And no, and even as again, it's not. It's just as simple as prescribing X and letting them go. Even with something like estrogen or thyroid or testosterone, there's a lot more to it. I mean, there's different dosing strategies. You can give testosterone in many different ways. And why do you do that? A patient may have problems with their lipids or cholesterol markers, or problems with their blood counts you need to address. So it's a different approach to a strategy in terms of, I'm going to dose you this way instead of this way, or I might do a different formulation or a different application, maybe an injection versus a cream. And even then, the dosing strategy is going to be different. The frequency of the dosing, the timing of it, what else you do with it in terms of supplements, diet, exercise, lifestyle, how you tie that in. There's different ways to make it work better, above and beyond just giving more or giving less. So there's different ways to do what you formulate the medication with, what you take with it, how you time it, all these different things based on what that patient is looking for. Someone may have problems with their blood counts or different sleep strategies or different things, and other people may not need those. So there's a lot more to it. And that's where, for me, I spend a lot of time with my patients and my clients. I really try to dig down what's important, find out a lot about them, their lifestyle, their history, their genetics, their family history, what works for them, what are they really looking for, and then I try to dial in a program specifically for them, as opposed to just, oh, I'm going to give you this, this, and this, just take this and see you in 3 months, and kind of cookbook approach. That just doesn't work.
Yeah.
So that's what I try to do, is really make it more personalized and kind of get that feedback. What's working, what's not. Let's tweak it. Let's make it better, and let's really get down to the nitty gritty of what you need on a cellular basis, like not just a macro, big picture approach.
Yeah, I would say that the experience I've had too, it highlights more of the day-to-day lifestyle factors and behaviors, and instead of just slapping a Band-Aid on it with, well, yeah, let's take X supplement. It's like, well, how are we sleeping? What is our day-to-day? What is our stress like? Are we meditating? Are we working out regularly? Like, let's get those things in order first.
Absolutely.
But another question, and this is something I've seen a fair amount is I have a lot of men and women over the age of 45, 50, whatever it may be, and they talk about what they're dealing with, and we can ask some questions, and it's like, you know what? It sounds like you might be low on your hormonal profile here. Have you talked to your doctor about this? Like, yeah, well, I'm low, but they don't want to put me on XYZ because of X. What would you say to those patients that have been tested to be low or relatively low, or on the lower end of things, that have these symptoms, yet they have maybe a primary care doctor that wants to avoid hormone replacement therapy?
Yeah, and I hear and see that a lot, both online and in my patients, and I hear that from other people a lot, right? And there's two different things to this. One is the blood work approach. Back in the day, decades ago, medicine was truly medicine. It was an art. We learned to listen to our patients and take a history, do a physical, and the answer's there. The lab work was kind of secondary. Now back in the early 1900s, 1800s, right? I mean, they didn't have a lot of lab work, so they had to do that. But there's a lot of really smart wizards of medicine, who wrote books and study medical studies on this, and they were super talented. And then the whole lab work, and then big corporations, big pharma kind of took over. Now it's all about blood work, and it's like just to make it more economical, save money, right? And a lot of doctors have lost that skill, that art of medicine, and then they start to rely on blood work. I could talk. There's a whole big thing I could talk about this, but the unfortunate thing is that became kind of erroneous. So it's really about treating that patient. It's not really about the blood work, because a lot of people are going to have symptoms and problems no matter what the blood work shows. And for thyroid, testosterone, it's a great. I see this especially in the thyroid world a lot. Someone's going to come in there, have all the symptoms of a low underactive thyroid, and their lab levels are quote unquote normal. Well, I'm still going to treat them, because even though the levels are normal, they're still having symptoms. And then there's a whole different topic of like, well, what's in the blood versus what's in the tissues. In the tissues inside the cell. That's why what I do when I practice cellular medicine, what's really going on at the cellular level. Let's fix that. And in your blood work, you can have all the thyroid hormone or whatever floating around, and the levels are great, but it's not getting into the cell to do its work. It has to get inside the cell through these little receptors. It has to get to the gene level to turn on DNA, what we call DNA transcription. It has to do all this work. If it's not getting into the cell, it's not going to work. If it's getting in but not affecting the genetic code, it's not going to work. If there's things blocking it in the blood, it's not going to work. So there's a lot more to it. Even if they're taking a thyroid hormone, for example, if it's not doing all these things, it's not going to work. So if somebody has these symptoms, there's something wrong. And that's when I have to do that deep dive, peel the layers back of the onion. Do you have a lot of toxins that are blocking these receptors? Do you have a nutrient deficiency that's affecting your genetics, that it's not what we call a co-activator of the hormone, or something else is going on, right? Or you're on the wrong medication. So it's the cellular effects, and that's what I have to dig down on. It's not just the blood level. And speaking of the blood level, it's not just about normal versus optimal. Is a whole other topic too, because somebody could be in the normal, quote unquote, normal range, but it's not optimal for them. Again, everybody's different, right? Men are a great example for testosterone. They have these genetic code called CAG repeats on their DNA sequence that can determine how sensitive they are to testosterone. Some guys, based on the length of this repeat on their genetic code, don't need much testosterone. Others need a lot more. And then there's also the sensitivity issue, like we were talking about the receptors and all these different things. Some guys are more sensitive, kind of like some people are really sensitive to blood sugar spikes, and other people not so much. I can eat a banana, no problem. Other person can't, because their blood sugar goes crazy. Same with testosterone. Some guys just don't need as much. So same thing with thyroid, same thing with everything. So that being said, again, on that spectrum of normal, say on a scale of 1 to 10, you could be a 1 and still be normal, right? Kind of like what I always say, like when you take your tests in school, right? You can pass a class with an A, a B, a C, or even a D minus. You could still pass, right? Well, I don't want my clients to be, a D student. I want them to be an A student. So even though, if your hormone level is like a 1.2 on a scale of 1 to 10, yeah, you're normal. Your doctor's going to say you're in the normal range, but you're not optimal. You need to be up here. And again, where you are, it depends. And it's more about how you feel. Like I was talking about, some guys may feel better here, or girls maybe feel better here, or they need to be all the way up here. So that's a huge difference between normal and optimal. And then there's the whole conversation of, well, the levels are okay, but you're still having symptoms. Why are you having symptoms? Let's figure that out. And when you go to your primary care doc or your internal med doc, they do an awesome job, right? But that's not their specialty. Kind of like if you have a heart problem, an orthopedic problem, you go see your orthopedic doc, you go see your heart doc. Well, they're not hormone specialists. peptides is a whole specialty in and of itself. So you got to go see your hormone doc, like someone like me, because that's our specialty. They know a lot about a number of things, but they're not able to do a deep dive into all these things. That's why they refer to specialists. So hormones are the same way. So, nothing against them. They do a fantastic job, but they
I
have
completely
to punt
lost.
to someone who's a specialist in their field.
You just got broken up there on my end. Hopefully it still uploads clearly here.
Yeah. Did you catch all that, or?
I didn't, but hopefully the people do.
Okay.
I got bits and pieces of it. But I think one of the biggest pieces you said there, and that people need to realize, is like when we go in for regular blood work, like you said, like typical blood work, we're just measuring the whatever's floating around in the blood, not that's actually getting into the cell that makes the difference, which is probably one of the biggest mistakes or weak points we have in medicine right now. Is like we're kind of falsely testing what's happening, correct?
Yeah, exactly. So you could have normal amounts in the blood, but it's not getting into the cell to do its work. So if somebody still has symptoms of a deficiency, I'm going to treat them, figure out why it's not working. Do they have a toxin? Do they have a nutrient deficiency? Is there a lifestyle factor of a diet deficiency? The wrong dose of the medicine, the wrong timing of the medicine. There's a lot of other factors. So let's fix that. And then number two, even if it's kind of normal in the blood, it may not be optimal for them. So they need to be at a different level to get the job done. So they may need more or less of a certain medication, or they need a different formulation of it, or a different dosing strategy, or something else to be taken with it to enhance its absorption and its effect. So, and it's really about the patient and their symptoms, and then number two, about their lifestyle and all these other factors that come into play. Inflammation, toxins, lifestyle, sleep, stress, all these nutrient deficiencies, and then of course just fixing the level. And again, everybody's different in terms of where they need. It's not always more is not always better. And I've seen, especially, and this is notorious with guys, they always want to know, what's my level, doc? What's my level? I want more. I want more. It's that whole American, like, more is better. Like, no, sometimes it's worse, actually, and you can cause harm or get the opposite effects. So more is not always better, and it's about getting the right amount at the right time. So, yeah, it's both. So, yeah, it's a great point.
And then is a lot of the hesitation, maybe a typical primary care, urologist, endocrinologist, OBGYN, what is a lot of their hesitation based around? Is it false information off those old studies we talked about on the podcast, or?
Yeah, I think it's two things. Number one is just kind of ignorance, and I don't mean that in a mean way, meaning they just don't know enough about it. Kind of like me, it'd be like me talking about like the latest laser arthroscopy procedure for a spinal fusion. I don't know the current data. I couldn't speak to that effect. So they don't know enough about the world of hormones, peptides to speak to that effect. It's just outside their wheelhouse. And then number two, yeah, I think a lot of it's just misinformation. A lot, like you said, hormones have been used for decades. And then, the WHI trial came out and it jaded everybody. But then we found out later it was a very faulty study, and there's a lot of wrong information. This was actually proven, and they even made a statement about it, but it kind of was, the cat was out of the bag at that point. So we realized it was totally wrong. And everything was wrong about that study, but unfortunately put the fear of God, and everybody kind of like what happened the last couple of years with certain things, right? So, get some things out there and it changed, everybody freaks out and, we can't do this anymore. And even though we turn out, that actually was not true, right? But that's still out there. It's kind of, and it just takes time to unlearn that. And there's just a lot of myths out there that have been around for a long time that have been proven. Like a study comes out saying X, and then 300 studies come out later disproving it, but people still have that thing. It's called confirmation bias. They can't get that original thing out of their head. And in every specialty, every business is like that, right? I mean, even in medicine, it's slow to change. I mean, look at, how many years was like, fat is bad. We got to get rid of fat, and low-fat diets. And I like low-fat diets. They work for me. They work for a lot of people. They still do, but the whole thing that fats are evil and they're going to cause all this heart disease. And now we know that's not true, right? Eggs were demonized for years, right? Now we know they're extremely healthy, right? And they're very good, but look how many decades it took for medicine to course correct. It's like the Titanic. It just took forever to move that ship, So I think it's just a gap in knowledge. And then number two is that confirmation bias. I still hear to this day, like, testosterone? You're going to get prostate cancer, a heart attack, and a stroke. I'm like, that is so not true. There's hundreds of studies disproving that, right? Same with estradiol, estrogen. It's like, you're going to get a clot. That's horrible for you. You're going to have liver problems. And it's like, that's never ever been shown for estradiol. You have Premarin and Prempro, these synthetic Frankenstein hormones, yes, but for estradiol, bioidentical, never ever been proven. Period. Um, but you can't. People can't get that out of their head. So I think it's both. I think it's just a lack of specialization because they don't know, that's not their field. And number two, the confirmation bias, just all these myths that have persisted through the years.
Mm. And the last thing I kind of wanted to touch on here that we touched on a little bit on our last call was, there's some weird things happening with people nowadays with these, as you called them, post-vaccine injuries and long COVID. And then there's that patient I messaged you about yesterday that I want to send to you that's like got Epstein-Barr and overtraining syndrome and adrenal fatigue, and there was like 3 or 4 other diagnoses. So
Right.
I'm seeing too, or I'm hearing a lot about like people having pot syndrome. So what is it you can do for people that have experienced something as far as like long COVID or maybe something happened from the vaccine, we think, or just these general like over overly worked bodies syndromes, I guess.
Yeah. Oh my gosh. Well, this is like a 3 hour conversation, but yeah, I mean, we talked a little bit about that before. Kind of like with the whole confirmation bias, and I don't want to make anybody angry, but it's the same thing, right? Oh, like masks, let's do it, but then we found out later that there was nothing about that. They don't work. They don't really do much. The shots. Oh, they work. No, they don't work, and so, whatever. A lot of people are gonna say they do. First it was they do this, but not this. Oh, well, you're right. They don't do that, but they do this. Oh, wait, no, they don't do that, but they do. The story kept changing, right? And things were just kind of made up. 6 foot. No, it was just made up. Whatever. But yeah, the bottom line is, and I'm not like anti this or whatever that. I'm just what works, what doesn't work, right? So, but unfortunately, yeah, there's a lot of vaccine injuries, and I'm seeing a lot of them. A lot of my colleagues are seeing them. The FLCC Alliance is a great organization, seeing a lot of this stuff, and we're seeing more and more of this coming out, and it's just irrefutable. Of course, it's being labeled as other things, right? Because the narrative doesn't want to change or admit things, but it is what it is. Unfortunately, things are happening, and there's a lot of these things happening from vaccine injuries. And yes, of course, there's a lot of people getting long haul COVID, adverse effects from COVID itself, but a lot of people are getting things from the shots too, unfortunately, and there's a lot of hesitancy now about resuming this because of this. People dropping dead, heart attacks, strokes, clots, blood clots, infertility, and these are incontrovertible. And again, it's multifactorial. Of course, there's a lot of things going on as well, but I think the data is becoming more and more clear every day. There's some issues, and I have seen a number of patients with this, and I've treated a lot of patients with this, and a lot of my colleagues have as well. There's a lot of data out there. A lot of people doing a lot of good work and studies, showing treatment protocols and resolution of these things or improvements and things like that. So, and it kind of goes hand in hand with what you said. There's a lot of other, viral things and autoimmune conditions and burnouts. Like you said, you were talking about overtraining and different things. I see it more and more. And unfortunately, a lot of it, I think, has to do with not just what we were just talking about, but I think we live in a very toxic world. I think we touched on this before, but our bodies are just not adapted to it. We're just battered and exposed with all these different things. Our bodies just can't keep up with. There's crap in the air they're spraying, right? Chemtrails, and there's crap in our food and glyphosate in our water supply and pesticides and plastics, little microplastics and nanoparticles, all these phthalates and these xenoestrogens, all these different things in our food and our water supply. Our soils are getting depleted of vital nutrients and minerals like magnesium and selenium and things like this. And we're bombarded by, EMF. We're around these devices all day. We're sitting inside with no fresh air, no sunlight. We're not touching the soil. We're protecting our bodies are clothed with synthetic fabrics 24/7. You know what I mean? So, I just feel like we've just kind of lost our natural connection to Earth, and it's like we need to get back to nature. And so I think this artificial environment we're in and exposed to is taking its toll. And so when we do get an infection or do get a virus, our immune systems are so hammered already with this and all these inflammatory processes. It's just we're weakened already, and it just takes a double whammy. And then people are like, oh well, on top of that, let's go train and do CrossFit 5 days a week, and then I'm gonna cold plunge, and I'm gonna fast, and I'm gonna do all this stuff. Our bodies are just like, what the fuck, enough. I'm tapping out. And they're gonna be like, pfft. They get this POTS and the overtraining and red S, all these different things, and their bodies are telling them something. So I think it's very multifactorial in this regard. And I'm seeing a lot more. A lot of my colleagues are seeing this a lot. So there's definitely a whole treatment strategy approach to this, and it's across the spectrum. You changing your lifestyle, changing your diet, medication protocols, and things like this. So very, very, very complex. But seeing more and more of this every day.
Very nice. And anything else you want to add before we close out here?
No, I think that's it, man. This has been great. I think the biggest thing is just, there's a lot to it, right? And I think more and more people are becoming aware of looking at natural approaches to health and alternative strategies, holistic strategies, other things outside the traditional medical world. I mean, I was there. I mean, I was an ER doctor. I was in the traditional medical world for a very long time. I have great respect for those institutions. Unfortunately, it's been kind of a mess. It's more of a, economics and politics have kind of taken over at this point, and it's kind of put shackles on a lot of the docs, and they're doing a great job, but they're limited by what they could do. They're restricted, and they're putting these holes, and big pharma kind of runs the roost. All these big institutions are kind of running the show, and it's like, and they have an agenda, unfortunately. So I think more and more people are starting to become aware of our loss of medical freedom and freedoms in general, and they're seeking alternative solutions. So looking for providers like me and my colleagues who can offer some other things to them. And I just like to offer patients different strategies, and I'm not like, you can't do this or don't do that or don't go see your doctor, don't get a vaccine. I'm not saying that. I just want to present people with options and try to, and my whole thing, I just want to help people, whether it's me or someone else. I just want to give them some help and some opportunities and some options to better their lives and improve their quality of life and improve their health, not just for themselves, but for their kids, their grandkids, and their families. I want people to live better, live stronger, and feel good about themselves and make other people feel good. My mantra is like live to give. I want people to feel good so they can help other people feel good too. So I think just taking back natural health, trying to get things as back to nature as possible. I want people to get outside, look at, get your face in the sun, get your feet in the soil, breathe some fresh air, get in the woods, experience nature, and try to keep as healthy a lifestyle as possible. Eat organic, exercise, rest, sleep, have sex, communicate with other people face to face, get off the phone, do things as naturally as possible. I try to do everything, all the free stuff first, and if they need hormone optimization, peptide therapy, these other advanced strategies, I'm definitely happy to help with that because they work. And we need it because of the world we live in. Unfortunately, all these things may not be enough, and we may need, especially as we get older, to help lose the weight, to feel better, to improve your menopausal symptoms, to improve your bone health. We may need a lot of more and more people are going to need natural hormone therapy. They're going to need peptide therapy. They're going to need some other strategies to do this. Sometimes it's not enough just to live healthy. So that's what I'm here for, and that's what I'm offering. And I love working with people in this all ages, but definitely, obviously, people in their 40s and up that are going to need it the most. But I'm seeing younger and younger people being affected again because of I think the world we live in. So, that's it. I think just keep your options open. Work with your docs. Look for people that are willing to think outside the box, and look at some alternative strategies, and find someone that you work with that you feel comfortable with that is willing to look at alternative strategies and really ask you a lot of questions. Find out what you're doing, what you're looking for, and why you're looking for it. What's your why? Not just give your protocol and, you just need this, this, and this. Like, why? Why do you want that? Ask more questions, get more personalized. And if you're not working with someone that you feel comfortable with, keep looking, because you got to find the one that's for you. Absolutely. So where can people find you? Yeah, man, I'm all over social. So Dr. Eric Prime X is my site, my main website to get to. I do have a ton of free stuff and free ebooks and downloads on my website. On social media, I post a lot of stuff on my personal page and my business page. So Dr. Eric Fete and Dr. Eric Prime X, and then Dr. Eric Fete on Instagram. And then my YouTube channel is Dr. Eric Prime X. I've got a ton of videos there. Feel free to peruse. And then again, drericprimex.com is my website. Feel free to check me out and take advantage of my free stuff. And if you want to reach out to me, I'm doing consults and telehealth all across the country. So reach out. Happy to help. Yeah, and we'll include all that information too. So this will be up on YouTube. We'll put it on our website. And then we've also had Dr. Fate here on the podcast too. So I don't think it's dropped yet, but it should be this week or next week. So if you want to learn more about the ins and outs of hormone optimization and some other things as well, feel free to check that out. So thank you for your time, sir, and hope you can help some of our patients in the future. Thanks, Brett. I appreciate your time. Hopefully I provide some value. Everybody go out and have an awesome day. Do something nice for someone. Pass it forward. Have a good day. Thank you.